Hello, my name is Olouchi and I'm here with Saadia and Gertrude, and we are playing a role on DBT, that is dialectical behavioral therapy, and let's dive into that. The title is Holding On to Hope, a DBT session for suicidal thoughts. And we are with a patient named Sarah, a woman in her late 20s, struggling with suicidal thoughts, feeling trapped in despair. And the setting is a therapy office.
Sarah, I see today that you're having a really hard day. Can you tell me a little bit about it?
I don't even know why I came today. Nothing is going to change.
Sounds like there's a lot of hopelessness. Right now, I want you to know I'm really glad that you came. Even when it feels pointless, just showing up is an act of strength.
Strength? I don't feel any strength. I feel done. I don't see a way out of this. I just want it to stop.
That makes sense. When people feel overwhelmed like this, their mind tells them that there's only one way out of it. I promise you there are many ways out of it. Can we calm this down together?
I guess.
Step 1, mindfulness, observing thoughts without reacting.
Right now it feels like your emotions are screaming at you. Instead of reacting to them, let's just notice them. Close your eyes and let's try to name 3 emotions that you're feeling right now.
Tired, hopeless, and alone.
Thank you for naming them. Now imagine you're standing on a bridge, watching those emotions float down like a river. Just watch them. Do not grab onto them.
Okay.
Those feelings are real, but they are not forever. Let's just keep them moving. Your emotions will move too. Can you see that?
Maybe.
Step 2, radical acceptance, acknowledging the pain without judgment.
I want you to introduce to an idea called radical acceptance. Right now you're in a lot of pain, and that pain is real. But fighting this pain, fighting reality is only going to make it worse. Blaming yourself is also going to make it worse.
So I should just accept my life is terrible?
Not that your life is terrible, just that this moment is terrible, and this moment is unbearable.
I don't know if I can do that.
That's okay. Accepting doesn't mean that you have to accept how terrible your life is. It's just to accept how the moment is, and then you move forward with that.
Okay, and step 3, distress tolerance, calming the nervous system.
Right now your emotions are 10 out of 10. So let's bring them down a little together. Are you ready for that?
Yeah.
Have you heard about tip skill?
No, what's tip skill?
Tip is temperature. It's also intense exercise, paced breathing, or progressive muscle relaxant. Let's try temperature first. I'm going to give you this ice pack. It's wrapped in the towel. Tell me if you can feel the cold. Just focus on the sensation that this ice pack is giving you. Can you do that?
It's really cold.
Exactly. The cold helps you reset your nervous system, slowing down the crisis response. Do you even feel a tiny shift?
Maybe a little.
That's a win. Now let's try paced breathing. So for paced breathing, you're going to inhale for 4 seconds, then you're going to hold on to that for 4 seconds, and then you're going to exhale for 6 seconds. Do you want to repeat that to me?
I inhale for 4 seconds.
Mm-hmm.
I hold for 4 seconds.
Mm-hmm.
Then I'll exhale for 6 seconds.
Okay. On my counter. Okay? Count to 3. 1, 2, 3. Inhale. 1001, 1002, 1003, 1004. Pause. 1001, 1002, 1003, 1004. Exhale. 1001, 1002, 1003, 1004, 1005. How does that feel?
That feels okay. That really actually helped.
Good. That means you can regulate these emotions, even when they feel uncomfortable.
Step 4, opposite action. Moving against the suicidal urge.
What if it doesn't last? What happens if the thoughts come back?
They might. There is another DBT skill called opposite action that you can try. Right now, your mind tells you to withdraw, to give up. Can you tell me what is the opposite of withdrawing?
Reaching out?
Great, yes. Do you have somebody that you can reach out to even when you don't feel like it? That's how we disrupt the cycle of depression. If you were not feeling this way, what would be something that you'd be doing?
I like reading and drawing.
Great, art is great. What would you be drawing today? And it doesn't have to be perfect, just do it.
I can try to draw some flowers.
That's great.
Step 5, creating a safety plan.
Now let's talk about something that is the most important thing we'll discuss today. That is about a safety plan. Whenever these thoughts come back to you, and instead of acting on them, what is it that you're going to do?
I don't know.
We're going to list 3 things together. So first thing is the distress tolerance scale, the temperature we did, the pace breathing we did, the distractive activities we did. That would be one of the things that you can do. The second thing would be you can reach out to someone. Do you have somebody that you can reach out to when you feel you cannot keep it together?
I can always call my sister, but I would hate to disturb her and drag her into my problems.
I understand that, and that is why we have these hotlines. They're 24/7. They are trained people who have been working with people like you. I will give you on the safety plan, we will write down the numbers, suicide hotline, and as well as those 24 hours crisis line. Would you promise me that you would reach out to them?
I will try.
That is all I ask. We don't have to fight this alone.
Closing the scene, holding on to hope.
Maybe I can hold on a little longer.
That's all we need. One moment at a time.